Anti-amoebic drugs. Before going to that, let us see this diagram. This amoebiasis occurs mainly due to the ingestion of the cyst, amoebic cyst. So how does this amoebic cyst will cause the amoebiasis? So this cyst which has been ingested already, it will reaches the intestine. In the intestine, it will get multiplied, and the cyst will be released, and again the released cyst will be stored in the intestinal lumen as well as in the tissue, and from here it will be carried to the liver, and it will be stored here stored here. So this is the luminal, this is the tissue, and rest of the cyst can be released out of the feces. So in the feces it can be passed out. So cyst enters, it multiplies. So please remember, cyst will enters, it multiplies, it releases this cyst, and this cyst will be taken up and it will be reaching the liver. If the cyst is present within the lumen, it is called as luminal amoebiasis. If it reaches the tissue, that is the liver, it is called as tissue amoebiasis. So what will be our target sites? You can target the luminal amoebiasis, that is the luminal amoebicidal agent, luminal amoebicides. If you target the tissue amoebiasis, it will be your tissue amoebicidal agent. So if you are targeting both the luminal as well as the tissue, it is called as luminal tissue amoebicidal agent, which has got both the activity. So let us see the examples. So the drugs which are inhibiting the luminal amoebiasis, they can be remembered it as DIP. DIP. So it stands for luminal amoebicide, luminal you dip. So in the lumen, the cyst will going to die or dip. They will be dipped into the lumen. So that's why luminal it is DIP. So DIP stands for diloxanide, I stands for hydroquinol, and the P stands for paromomycin. DIP stands for the diloxanide, hydroquinol, and paromomycin. And if it is in the tissue, what are the example? We have a emetin as well as the chloroquine. Emetin and the chloroquine are the tissue amoebicidal agent. What about the drugs which are having both the activity against the luminal as well as the tissue? We have a MOTI. So MOTI, what will do? MOTI will eat they will eat from everywhere. So these drugs will eat and they will be attacking everywhere. They will attack the lumen, they will attack the tissues. That's why they will become a MOTI. So MOTI. So luminal and tissue will have a MOTI, and only the lumen will have a dip. The cyst will be dipping. So luminal and tissue, we have a MOTI. The example is the M stands for the metronidazole, O stands for the ornidazole, and T stands for the tinidazole. So this should be remembered. So please remember this mnemonic. The luminal amoebicide, how you need to remember? In the lumen, the cyst will be dipping into the intestine. So that's why the mnemonic DIP. Diloxanide, hydroquinol, and paromomycin. Whereas in the tissue, it is chloroquine and emetin. But in both the activity, the drug which are showing the both luminal and the tissue amoebicidal agent, they will become MOTI when they consume both the tissue as well as the luminal cyst. So that's why they are called as MOTI. That is metronidazole, ornidazole, and the tinidazole. So moving on to the individual drugs. So that's what the drugs which are used for amoebiasis. It is mainly caused by Entamoeba histolytica. It is a cyst. Which are the cyst which is entering into the lumen? They are due to the Entamoeba histolytica. Again, this can be asked in your exams. Entamoeba histolytica is causing the amoebiasis. Entamoeba histolytica. So we can classify into tissue amoebicidal agent and the tissue and the luminal. So this tissue is also called as extraintestinal amoebiasis. The drug here we can use is the chloroquine in the extraintestinal, that is the tissue. In case of the